Yeah. Okay. Good morning. As all of you are aware, Medicaid modernization was officially launched in Iowa last Friday. And by the reports that we've received, the transition to managed care has been smooth and went off without any major disruptions to Medicaid patients or the providers that are serving them. That's great news, and I want to commend the Department of Human Services and the managed care organizations for their good work. As you know, 39 other states and Washington, D.C. have already done what Iowa is now doing with modernizing the Medicaid system in place, in a place that makes it possible for us to have more doctors to serve our Medicaid patients than ever before in providing better care for patients by improving access to quality services. Today, I've asked the representatives of Amerigroup, AmeriHealth, and United Healthcare, the three managed care organizations, or MCOs, that are now operating in Iowa, to join us and talk about a few of the many value added services that Iowa Medicaid patients and their families can now enjoy. The services that these three managed care organizations are providing were not offered under the old fee for service system that operated prior to last Friday. These are exactly the types of additional services that are going to make lasting, meaningful impact on improving the health of Medicaid patients. It's important to remember that benefits uh, do not change under the managed care system. So the benefits that were there before are there, but these are new services that are also being provided. Uh, on top of the old services, the benefits Medicaid patients have access to from these three managed care organizations now include over 80 additional value added benefits. Some of these benefits include additional pregnancy and prenatal care, a 24-hour nurse hotline, Boys and Girls Club memberships, weight management programs, and tobacco cessation programs. Our old Medicaid program did not provide many of these value added services that are designed to improve patients' health. By leveraging the experience of other health systems, the Iowa Medicaid patients now have more opportunities to live longer, healthier, and happier lives. And now I'm pleased to turn it over to Lieutenant Governor Kim Rouse.
Well, good morning, and thank you, Governor Branstad. Through managed care, Iowans' health care delivery will improve by offering preventative services above and beyond what was available to them under the old Medicaid system. By reducing emergency room visits, hospitalizations, and surgeries, and eliminating unnecessary or duplicate services, patients will have what the ultimate goal is, better health outcomes. And the Medicaid program, in addition to those better health outcomes, will be more predictable as well as sustainable. As the governor indicated, we've seen in 39 states in the District of Columbia, managed care has improved access and quality for Medicaid patients. Nationally, we've seen Medicaid managed care programs increasing assessment rates, screenings, as well as timeliness of care. For example, from 2010 to 2014, managed care programs doubled the number of adults who participated in the Adult Mass Body Index assessment. So just like my healthcare and all of our state employees' healthcare, we really encourage individuals to undergo a health risk assessment annually. These assessments identify health risk, ensure preventative care, and prevent unnecessary visits to the doctor. We know that critical care like this is essential to making our population healthier. States across the nation have seen the benefits of services that are now being offered by our MCOs, like our health plan partners that are with us here today. In California, seniors and persons with disabilities rated their access under managed care as better than their old Medicaid system. Seniors and persons with disabilities in California had better access to their primary doctors, prescription drugs, as well as and disability services. We know that from other states' experiences that over 40 million people on Medicaid managed care programs have better access to care and, again, better health outcomes. So now I would like to welcome Cynthia McDonald from Amera Group to come forward and tell you more about some of the value-added services that the governor and I both highlighted. And then we'll have the opportunity to hear from Amera Health as well as United. Cynthia?
Thank you very much. It is my honor, and I thank the governor and the lieutenant governor for this opportunity, actually, for us to, as managed care organizations, and in Mira Group, in my case, to come and talk about these important services that help the important goal of improving health outcomes for all Iowans, and those, of course, in particular on Medicaid and the Hawkeye program. I'll highlight quickly just two, and just know that this information is also included in our member handbooks and on our website, and also accessible through our call center as well to assist members in knowing the full slate of programs available. We have something like 25 programs available. So again, I'll highlight two. Healthy Rewards and community integration. Healthy Rewards is an incentive-based program to try and help drive health outcomes. So it's things like if a parent has a child complete all their immunizations, there's a certain dollar amount that is assigned to that for that incentive. It is loaded on what is called a Healthy Rewards debit card, and then they use that money then in turn to buy things like diapers and other kinds of things that are approved and working with their case managers approved that allow them to be able to improve or add to the health care that they provide for their families. The other one is the community integration program. It's one of my favorites. Community integration are for individuals who are perhaps in nursing facilities or intermediate care facilities for people with disabilities. And of course, one of the goals of programs is to provide care in the place that is best and safest for individuals. So if there is an opportunity for a person to go home or go back into their communities, this is a program that provides up to $2,500 to allow for that. So it helps them because, people don't have lumps of cash. And so it gives them the opportunity to have money for rent, for deposits on utilities, real practical kinds of things, perhaps household goods that help them come home, sustain in their homes. And the outcomes around these and many of the other programs that we offer are again, drive that outcome piece and are some proven pieces. The other thing I'll add, the last thing is that for Iowans too, as we continue our work here, we will also evaluate these programs and then add programs that really make sense even further perhaps into the communities of Iowa. With that, I will turn it over to my colleague, Cheryl Harding from Amera Health.
Thank you, Cynthia, and thank you to the governor and lieutenant governor for allowing us to have the opportunity to share with you some of the distinct advantages of managed care programs, and one of those being the value-added benefits. Those allow us to do additional services that help our members get healthy and stay well. One of our really special value-added benefits is our Bright Start program. Bright Start is a specialized care management program designed for moms-to-be. It's a program that members become eligible for as soon as they're pregnant, and it gives them access to services that help provide education and specific prenatal services that they need throughout their pregnancies. One of the specific things we've designed within our Bright Start program is an ability and a process to assess a member's risk and then provide those services that are specialized to their unique needs. For all of the members in the Bright Start program, we connect them with services in their local communities as to get prenatal and maternal benefits, and then we work collaboratively with their providers so that we can ensure their engagement with prenatal services and appropriate prenatal care throughout their pregnancy. One of the other benefits within this Bright Start program is a mobile application that all the members are eligible for. And that allows the moms to have access to a free application that they can access 24 hours a day, 7 days a week to get real-time information related to their health. A really special part of this program is our community baby showers. So we'll hold baby showers throughout Iowa in various different communities, and they're really fun, positive events for the members that really focus on ensuring that members have the opportunity to have a healthy pregnancy and delivery. At those baby showers, there's an opportunity to have health screenings. There's prenatal information and education available to them. And again, an opportunity to connect our members with prenatal and maternal services in their local community so they can continue to access those on a face-to-face basis as well. In addition to our Bright Start program, one of the other programs I'd like to share with you is our nutritional counseling programs. We are big supporters of Iowa's Healthiest State Initiative, and as part of that support, we have a nutritional counseling value-added benefit. And this is available to every one of our members throughout the program. Members can access that service by calling our member services line that we publish to them in a variety of different ways. And we can connect them to a nurse care manager that can talk to them about weight loss questions they may have, or provide information related to healthy eating habits, the importance of physical activity. And again, we strive to connect members to nutritional counseling services that are in their local community. It's really a pleasure to get an opportunity to share some of these. We too have many, many other value-added benefits, and we'll continue to identify benefits as the program evolves and we get an opportunity to see what the needs of our members are. And with that, I'm happy to introduce Kim Foltz, who is the CEO of United Healthcare Community Plan of Iowa.
Thank you.
Good morning. Thank you, Cheryl, and thank you, Governor Branstad and Lieutenant Governor Reynolds, for the opportunity to be here this morning. With this HealthLink expansion, United Healthcare is honored to serve over 700,000 Iowans today, and providing programs and resources and tools for Iowa HealthLink members similar to programs that are offered today to our various other Iowans that we serve. One of those value-added programs that we're excited to talk to you about today is our Baby Blocks program. United Healthcare knows moms and babies, and this program allows us to engage moms through their pregnancy to ensure that they have timely information about appointments, about information that's critical throughout their pregnancy, reminding them of doctor's visits, but also key milestones for their children. There's also rewards associated when our members go to those doctor's visits. So we're excited about the opportunity to ensure that Iowa moms and babies can live healthier lives. As a native Iowan, as a nurse, and as a mother, I'm thrilled to be able to offer these programs to Iowans. And on behalf of over 600 Iowa employees serving Iowa HealthLink members, we're very excited about this opportunity. Thank you.
Okay, with that, we'd open it for your questions. I want to thank Cynthia, Cheryl, and Kim for joining us and for sharing with us some of the new services that are now available.
These value-added benefits vary depending on if someone is signed up with your organization, the benefits be different. One of the things legislators have been trying to figure out is exactly how many doctors are now available to serve Medicaid patients. Can you tell us that number today?
I don't know. Can you tell us the number? Each of them have different doctors that have signed up, different providers. We're told that the number of providers is more than was available under the old system, but can anybody give us an exact number?
From a provider perspective,
You're gonna come over here.
From a provider perspective, we have near 30,000 providers in our network.
That was also a key component of us getting the
Right.
waiver.
That was,
We had to meet a certain,
we had to meet very stringent criteria from CMS on this. And frankly, the criteria were much stricter than some of the previous states that have received approval in previous years. And we worked very diligently through that process to get that approval and to make sure that we were able to assure people of that. We're continuing to work to make sure that we make this transition as smooth as possible.
What does that additional state oversight look like for you before the end of the session? Both sides are coming up with something. Curious what works for you.
Well, we are working with them. We did last year, and we're continuing to work with them. Department of Human Services. Actually, I went down, I think on Fleur Drive and and not Fleur Drive. It's on Army Post Road. I went down on Army Post Road and actually met with the staff that provides the oversight. And so we have a whole building. I think it used to be an Aldi's grocery store where Department of Human Services, Medicaid oversight staff are there. So we're committed to working with the MCOs and working with the providers to make sure that that oversight is provided.
And do you still agree that there's no need for additional oversight? In January, you said these folks would do it.
Well, that's the whole idea of managed care. Before we had unmanaged care. So basically, we had a situation where you as a Medicaid patient went to maybe a half a dozen different providers. There's no coordination between the services. And the whole concept of managed care is to coordinate and manage that care to make sure you avoid duplication, you avoid conflicts in terms of medicine, so people don't end up getting sicker or reacting to different medicines that are in conflict with each other and end up back in the hospital.
So you would reject any bill from the legislature?
No, no, no.
for government?
No, I've never said that. And I approved oversight in the legislation last year. What I said is we don't need to hire an army of 130 some people and drive up the costs. We want to provide the very best quality care. And we want to make sure that it's coordinated and that we want to make sure that there's adequate oversight. And we've been working with the legislature on that issue, both last year and this year. And we're very hopeful that it will be resolved. And we resolved in a way that is a collaborative approach that does focus on quality of care. Well, first of all, this is specifically focused on the Medicaid population. Had some experience with this when I was at Des Moines University. You may recall at that time, we were one of the first to eliminate tobacco on our campus. I'm proud to say that's one of the significant accomplishments that led us to being the first college or university in the country to get the platinum level of recognition from the Wellness Council of America. Not just what we did with tobacco cessation, but the wellness center that we built, which I worked out at 6 o'clock this morning. We also incorporated wellness and prevention into our curriculum. That's why I'm excited about the new services they're adding. The old fee for services just paid you got sick, so you went to the doctor or hospital and they got reimbursed for the services. That was a reactive system. This is a proactive system that really helps people to try to preserve their health so they don't end up going back to the emergency room or to the hospital again and again. Well, the Department of Public Health has their own program, which primarily, I think, focuses on youth. This is a program that's offered by one of the MCOs. But first of all, we all know that tobacco is one of the biggest causes of lung cancer, heart disease, and many other things. So the more we can do, and frankly, the Medicaid population is one of the more vulnerable populations that if we can help them to quit smoking or not to use tobacco products, they can live longer and healthier lives. And that saves money as well in the healthcare costs.
This is a proactive approach. When can the public expect to see, at the end of the year, we'll see some type of report from the MCOs about whether these things are working, whether they are working towards fixing concerns that we have about our current system?
Well, it'll be ongoing, and maybe you all would like to address that, but we'll be getting updates throughout on a regular basis and how things are going. But would you like to add?
Sure, absolutely. Available to the public.
Sure, we'll be doing continuous monitoring on all aspects of the program. the traditional care pieces, the value added pieces, and we'll be doing reporting out to the public, to DHS, to the governor's office, to the legislature on how those programs are progressing and the successes that are achieved from those.
One issue that we talked about last week is patients whose doctors are not in the new program. And I understand there's a system in place where if your doctor isn't in the new program, that can be arranged on a case-by-case basis. Would any of you be willing to give some advice to a patient who's in that situation?
We try to take turns.
Yeah, so the advice would be around that the single case agreement. So that is very much an option for us, and we'll have a case manager work with the patient. So that's kind of the first step of that is the case manager will connect and take a look at what makes the greatest level of transition and less disruption for that member. And so by doing that, then it might be continuing with that provider who is not in the network, and it might be an opportunity to also do a transition into an additional or another provider. So it's all around the case management component and what's best for the patient and the best transition and the safest transition possible.
I would just say we want to encourage the providers to participate. And participation, as you heard, has gone up dramatically. So those that have chosen not to this point, we'd ask them to take another look at it and hopefully participate in the future. How many employees? About 300.
Is that the number of employees that are devoted to overseeing?
Well, they handle the call center and
So is it 300 total employees?
It's around 300 bodies. You have people who are, again, contract employees. The large number are the customer service individuals. You do have probably, I would say, 20 people or so that would be directly involved in what we would consider oversight. Working directly
Coming on
with
top of the 300?
out of that group.
Out of the 300. And have providers been told not to submit claims for 30 days?
I'm not aware of that. No.
And you're saying, and this is new, it just started Friday.
Right.
You're saying it's glitch-free so far?
No, well, I wouldn't say it. Nothing is of this magnitude is going to be totally glitch-free. But the reports I've been getting is that it's been relatively smooth. And there's all kinds of opportunities for people to call if they have a glitch or a problem to get that corrected as quickly as possible. And so we don't expect anything to be glitch-free, but we want to make it as seamless and as smooth as possible.
Is transportation to appointments a base service, or is that a value-added service? And then I'm hoping more and more of the MCOs can address it. And the reason I ask is late last week, just before the transition, there were some concerns in some pockets of whether patients would have that transportation because that had been contracted yet, whether they didn't know whether they were going to have a ride to their appointment on Friday. I haven't heard since how that went, so I'm just wondering.
So transportation is a base service required in the program. I can speak for AmeriHealth Caritas Iowa, and we definitely have contracts statewide for all types of transportations, which includes emergent, non-emergent medical transportation. And then our waiver members also have transportation services built into their programs. As far as I know and am aware, we had no transportation issues at all on Friday. So I believe contracts are in place and we believe adequate. And we've done significant outreach to our members to ensure that all scheduled rides were still confirmed, and done outreach to try to make sure that the members understand that those are ready and will be there and appear for them. Probably true for my colleagues.
Other questions on this subject, or would you like to go on to other subjects as well? the types of questions that they've received just over the weekend?
What I'll say is we haven't had very many questions. We've had, for instance, an example would be someone calling into the customer service line and verifying their address because they wanted to ensure that we had the right address. So it hasn't been intense. It's gone very smoothly as indicated, and so we're very pleased. And we move into day 4 today.
Contract employees who are part of the call center, are those all full-time employees?
It's a combination of full-time, but the majority of them right now are full-time.
And how long do you think that will remain that way?
We'll monitor, the volume of calls coming in, and we assume a higher volume in the beginning, and then they'll begin to drop off, and we'll adjust the staffing according to the volume.
Do you feel that the 200 days right now in this area is receiving enough calls, after 8 calls,
Last week on Friday, there we received over 3,000 calls.
3,000 calls?
Yeah, over 3,000. And the wait time was, we tried to keep that down as low as possible. I think that was approximately 2 minutes. So what we're looking at is number of calls, keeping the wait time down as low as possible, length of calls. And you got some, like with my colleagues, over the weekend, very significant. Actually, the last couple of weeks have been pretty busy, but I would say it was at least at that level, if not up a little bit. That was our first week.
This is the moving target. Can each provider say how many Iowa enrollees they have now that this is?
Yep, absolutely.
live?
For AmeriHealth Caritas Iowa, we have just under 203,000 members.
And for AmeriGroup Iowa, about 180,000.
For United Healthcare, just a little under 201,000.
Tell us how many providers you got for that population?
Sure. We have over 31,000, just under 32,000 providers.
We have just under 31,000 providers.
And I had previously indicated 30,000.
Okay, other questions? Okay, are there any other issues that you want to bring up today?
Just what's your expectations going into these potentially final session?
Well, we want to work closely with the legislature to try to resolve the differences. Some of the big ones have been resolved, such as supplemental state aid, the coupling issue. We are working on water quality. I think the bill has gone through the Ways and Means Committee. The vote was 19-3. We're very encouraged by that. It's going to Appropriations Committee. They have intention of adding additional things there that we've worked with them on. We're very hopeful it'll be approved through the House Appropriations Committee and then through the whole House of Representatives. And this will provide funding actually equal to or maybe a little more than we had originally recommended between now and the year 2029. So I think it's a significant first step to address water quality. We think there needs to be an even more long-term reliable source of funding for it, but it's a very important first step. We're hopeful that it can be approved not only through the House, but through the Senate before they adjourn this year.
Just to follow up on that, since there's a lot of different bills floating around, I just want to make sure I understand which measure right now you're really getting behind.
It's the bill that passed out, and Julie Vanderhoof has worked closely all session with Chairman Sands and with before that with Chairman Hine in the Education Committee, and now Chairman Grassley in the Appropriations Committee. And we are very encouraged about the progress that's being made and the approach that's being taken. And we think it's something that is sustainable and will provide the funding that we're looking for to meet the nutrient reduction strategy and to address both non-point and point source pollution.
Do you think that, I mean, you could run out of time, or is this something that you think would hold up the session?
Well, I don't think it should. We've been working on it all year. And like I said, the vote was bipartisan, 19-3 out of the Ways and Means Committee. We're hopeful that the Appropriations Committee will approve it this year. The House will approve it, and then it will go to the Senate. And there's been communications with the Senate throughout this process as well. But the primary work has been done in the House committees, and we're very hopeful that before the legislature adjourns, this is our top priority, water quality, and we're very hopeful we will see action on it this year. Yes, we feel this is a reasonable and sustainable source of funding that we do support, and we also support the way the dollars are being allocated. It's very similar to what we recommended at the very beginning, but we also said from the beginning that what we offered was a framework, and that this was a critical issue we wanted to see addressed. And we think this is a very important and significant first step.
It looks like medical marijuana isn't moving forward this session. You know, Meyer had referenced maybe a few weeks back that she was at least open to maybe changing something within our current law that we have in place, because there's still a lot of concerns that the current law just doesn't work. Is there anything that you can see yourself supporting in the session?
Yes, I've indicated a willingness to work with the legislature on this as well as other issues. I reserve judgment till we see it in its final form, but certainly this is an issue there is some strong interest in, and we have been open to and met with people about resolving this issue throughout the session.
Should it include a manufacturing system?
Well, as again, we reserve judgment till we see it in its final form. We want to make sure that we protect the state against unintended consequences and access to marijuana to people that would be using it for inappropriate or illicit purposes. What we have is cannabis oil, which is basically designed to treat a particular medical condition, and the question is whether that should be expanded to some others, and whether you could have it produced in the state of Iowa. Again, we want to make sure that if we're going to take action, that we do it in a way that protects both not only the health of the people that we want to assist, these families, but also doesn't jeopardize the health and well-being of the general population.
Thursday, you presented a revised budget document.
Yep.
The legislators indicating $23.3 million of adjustments need to be
Right.
made. Are there adjustments that you would not accept, or adjustments you need to do?
Well, we're great question. Okay. Well, first of all, I say we've already agreed with the legislature on a big share of the $46 million reduction that was necessary because of the reduced revenue estimate. That was done, of course, with the reduced level. I had recommended 2.45% supplemental state aid. What they passed was 2.25. They also, we've been working with them throughout with the Medicaid funding, and the Medicaid costs estimates have been reduced somewhat. And so that is taken into consideration. There's about 23 million of additional savings. The House and Senate have not quite reached the joint budget targets yet, and we want to work with both of them. And consequently, we said that we will work with both of them to try to resolve this and not create any conflicts. It's a tough situation for everybody. We don't have as much, thanks to the bird flu and the fact that farm commodity prices are below the cost of production. You probably already noticed land values, farmland dropped another 10% last year, 9%, excuse me. But that's 3 years in a row we've seen a reduction, probably again this year. So we've got to be very prudent and careful about our level of spending. We don't want to do like the previous administration did, promise things we can't afford and then have across the board cuts and those kind of disruptions. So that's the reason why we've taken this approach.
Thank you.
Thank you.